Hello again, this is Shawn Jackman with Clinical Mobility, and let's talk about hospital construction and the problems we see most of the time. These are multi-year investments, 4-5 years, and let's be honest, it's one of the best chances you have to introduce change. These projects have capital dollars that are hard to find to invest in modern clinical workflow technologies. Workflow that involves mobile devices, mobile applications, medical devices that rely on wireless connectivity for clinical alerts and alarms, and more. So you invest the years of hard work. You have the ribbon cutting ceremony, you have your first patients, and it's a resounding success, right? Well, unfortunately, the staff is reporting missed calls, missed clinical alerts and alarms, messages, codes, getting disconnected from the network. Escalations ensue. Patient safety is at risk. And this isn't a year later. This is within the first week of the hospital opening. So what went wrong? What could you have done differently? At Clinical Mobility, we have a phrase: start early, not over. Engage a wireless partner at the project onset, a competent one, of course, one who knows healthcare and specializes in wireless, who knows the latest devices, applications, use cases. So that's the starting early part. Now let's understand what we mean by starting over. We find that architects and general contractors are designing the wireless networks that don't work. We end up getting called in after hospitals open, when patients are being seen, when the network is being used, and having to redo work that's already been done. We're having to effectively redesign the wireless network, and that involves construction again. New cabling, moving assets, patching walls and ceiling that was just constructed. And most importantly, we're disrupting clinical workflow. We're having to go into patient rooms that are occupied. And this is while clinicians are frustrated that things don't work. So the months that it takes to do this work, usually, it makes the clinician's burdensome job even worse. So by bringing clinical mobility in early, we ensure that your new building doesn't open with yesterday's technology, and we ensure it works. We're healthcare mobility experts. We know the devices, the applications, the use cases better than anyone you'll find. So thank you for listening in today. Hope you learned something. Leave us a note below. Would love to hear from you. Thank you very much.